Today's session is about counseling. I have shared a poll on my groups about the sessions or the topics that you want me to help you in, and the most votes were for counseling. All right. So our topic for today is about counseling cases, how to deal with counseling cases in different situations and in different circumstances. All right. Before we start, I would like to tell you a few tips on dealing with counseling, and after that, we will have around eight stations with eight different people. All right? Okay, so counseling. Anyone can help me and tell me what is counseling? Anyone has an idea about what is counseling?
Giving an advice to the patient.
Okay, that's good. Yes, giving an advice. All right. So it's the process of communicating information and guidance, and giving support to the patient or their relatives to help them what? To help them either understanding a medical condition or test results, to help them making informed decisions, to help them in coping with their lifestyle changes or their new diagnosis. All right. So this is counseling. The GMC values patient-centered communication, and counseling cases is one of the essential cases in the exam. All right. Counseling cases test your ability to communicate clearly with the patients, and your ability to show sympathy and professionalism. All right. So, in general, counseling, giving, and advice. How to deal with different counseling cases, and what is the difference between counseling and history-based cases? Any idea?
So history-based, we are asking patient to reach a diagnosis. In counseling case, we already know the diagnosis and we need to discuss the management with the patient or
Yes,
advise them.
good. That's good. So, and what is the management generally in counseling?
Could be regarding the medication usage,
Yeah,
could be regarding lifestyle,
yeah,
habit, and
yeah.
could be how to he use the medication in the right way,
Good.
or could be about possible complication of the medication
Yes,
or
good.
the disease.
Yes, excellent. All right, fab. So yeah, so the management consists of one or two or all of these points. We can put them in one word, which is guidance or counseling. All right. Okay. So we have in counseling, I used to teach the candidates counseling like this. We put the cases in four main categories. Four main categories. So when we read the case, we try to fit this question in one of the four main categories, and then we use the structure of this category to deal with the case or to approach the case. All right, what are these four categories? The first one is counseling a concerned patient. Counseling a concerned patient. Usually, concerned patient is concerned about a specific disease or specific test results or specific test. The patient is asking for a specific test, or concerned about medication. He is coming to ask about a specific medication. All of these are counseling concerned patient. He's concerned about a specific thing. All right. So the main 3 points that you have to fulfill, not three, 1, 2, 3, 4, 4 points to fulfill in this category. What are they? Firstly, asking why. Why is the patient concerned about this disease or this test results or this medication, right? And you try to address this in your management, to address this concern, all right? You have to find what are the risk factors. In your data gathering, you search for what? What are the risk factors of having this specific disease, or that the patient is concerned about, or the risk factors of the disease that the patient is asking the medication for. All right? So usually the risk factors. We search for the risk factors of this specific condition or disease. All right? And then we check the patient's understanding about this disease and how we deal with this disease and how we deal with this medication. So the general information on his concern, all right? Check his understanding. How much does he understand about this test result or this test or this medication or this disease? And then you teach the patient what is this condition and how to deal with this condition, or what is this medication and how to deal with this medication. All right. And lastly, one of the most important points that you cannot miss in counseling is psychosocial part. Psychosocial part. Effect of this problem on the patient's life, patient's job, patient mood, if it's appropriate. All right. What is the patient's job exactly? Will it be affected by this medical condition? If the patient is elderly, who the patient does live with, what is his home condition or his dependency, his mobility, if the patient is very, very elderly. All right? Okay, this is in terms of concerned patient. All right? Got it, doctors? Clear? We
Yeah,
need to
yeah.
move.
Yes, yes, Dr.
Okay, good. That's really good. So this is concerned patient, and we will take two cases on concerned patient as a simulated cases, all right? Okay. The second one, which is follow-up cases or reviewing patients, this is the second category, following up a patient or reviewing a patient. Either this patient is going to be discharged from the hospital and you are reviewing the patient today before he's going home, or the patient is in the GP in his follow-up after diagnosis of a medical condition. All right, this is the second category, follow-up or reviewing a patient. The same main points in counseling can sound, but instead of asking why the patient is concerned, you ask the patient, how is or how are you now? How is everything now? All right, you check on the patient now. Are you okay? Is everything okay? Can you tell me how are you doing today? And then you follow the other points of the same structure. All right? Clear?
Yes, doctor.
Good. The third category, which is follow-up, but or reviewing, but the patient is presenting with new symptom or worsening of the symptoms that he has or she has. Okay, so it's reviewing, following the patient up, but the patient is coming today complaining of new symptom, all right, or worsening of the existing symptoms. All right, the same approach, but you have to add something. What is it?
To explore the new changes, like to ask more in the new symptoms.
Yes. So explore the new symptom or explore the symptom, the worsening of the symptom. So how frequent does he have this symptom? How much is it getting worse? So you have to explore this symptom. And then you deal with the structure as it is. All right? The last category, which is medication counseling. In medication counseling, you either explaining a medication to the patient or reviewing the medication that the patient is already taking. All right? So either explaining a new medication to the patient or reviewing the existing medications. Okay? So can you tell me what is the main thing that you have to fulfill in explaining a new medication? Any idea? In data gathering, especially in data gathering. If your task or your category of the case is explanation of a new medication to the patient. What is the
Maybe any
main?
contraindication or
Good. You have to exclude the
again,
contraindication of this medication. All right? As an FY2 doctor in the hospital, your consultant is asking you to prescribe a new medication. It's your duty to find out, is this medication safe to the patient or not? Safe, then you give the medication and you counsel the patient. How to know it's safe or not? Exclude the contraindications. All right? If your task is reviewing an existing medication, what you should include in your structure?
Patient compliant to the medication.
Compliance, the patient's compliance on the medication. All right?
Possible side effects of the
Yes, 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 that's good. That's correct. All right? So the structure is the same, but in each different category, we add something. We add something to show the examiner that we know what we are talking about. All right? Clear, doctors? Clear?
Yeah, it is clear, doctor. Thank you.
Good. That's really good. So now we are going to start our mock. All right? Okay. So let's pick up Dr. Hajar. Her exam is really approaching. Are you ready, Dr. Hajar?
Sorry, Doctor, can anyone start and then because I just need to do something quick.
Okay, no
okay?
worries.
Yeah,
It's fine.
I will be next, okay?
It's
Thank you.
fine. It's fine.
Thank
Dr.
you so much.
Ahmed? Dr. Ahmed, ready?
Yes, yes.
Good. Are you happy to switch your camera on, or it's it's not suitable for you today?
Well, it's not suitable for me today.
All right, no worries. It's fine. It's totally okay. Okay, so let's do the case. We will start by concerned patient, the first category. All right? Read your question, please.
Begin.
Start.
Hello, I'm Dr. Shimi. I wanted to do on the CPSA today. Are you Mr.
Hello.
Max Blake?
Yes, doctor.
Hello, Mr. Blake. Could you confirm your age, please?
I'm 64, doctor.
Nice to meet you, Mr. Blake.
Thank you.
So, Mr. Blake, I can see from my note you have been diagnosed with motor neuron disease. Am I right?
Yes, doctor.
I see, and you are here for your follow-up. Am I right?
Yes, I came today because I have some concerns.
Yes. Okay, Mr. Blake. Could you tell me more about it?
Sorry?
Could you tell me more about it?
Yes, doctor. I want you to prescribe riluzole for me, if you don't mind.
I see. So, how much do you know about this drug, Mr.
Well,
Mr.
I've
Blake?
heard about it, and one of my friends told me about this medication. He has also motor neuron disease, and he started on the medication, and he told me it's really good.
I see. So, how is he doing now?
He's doing okay.
Okay, Mr. Blake. So, before I address your concern, could you have a little chat about your condition?
Okay, no worries.
Okay, so how long have you been diagnosed with this disease?
6 months ago.
I see. And how was your muscle power?
I do have stiffness in my muscles.
I see. Do you have any weakness?
The stiffness is the most thing that I'm complaining of.
I see. What is exactly is this stiffness?
In all my muscles.
I see. So I can see from my notes that you have a follow-up every 3 months with the neurology clinic,
Yes,
and you are going to them.
yes, yes, yes. The last
I see.
appointment was 1 month ago, so I supposed to
I
go
see.
after 2 months. Yeah.
Okay, okay, that's very good to hear. So Mr. Blake, do you have any medical condition I should be aware of?
No, I don't have any other medical conditions.
I see. Have you been prescribed any medication for your condition?
They gave me some muscle relaxants.
And see, and are you compliant to them?
Yeah, I'm taking it. Yeah, but
Do you,
I can't see any improvement, to be honest.
I see. Do you take them as prescribed?
Yes,
So how do you use them?
I use it 3 times a day.
I see. So Mr. Blake, regarding your diet, could you walk me through it?
My diet?
Yes.
I'm eating healthy, doctor.
Mhm.
Hello, I'm eating healthy. Hello? Is there a problem in my side, doctors?
We
No,
can
Doctor,
hear
your voice is clear.
All right.
Hello.
No.
Hello, can you hear me, doctor?
Yes?
Okay, sorry, I have
No
problem with my
worries.
connection.
Yeah, my
So,
diet is okay. I'm eating healthy, doctor.
okay, that's very good to hear. Do you smoke?
Yes, I do smoke 20 cigarettes per day for since I was teenage.
I see. Have you tried to stop smoking?
Well, I didn't try before. I didn't consider that in my mind.
Okay, okay, no worries. Do you drink alcohol?
No,
So what do you do? What do you do for living, Mr. Blake?
I'm retired.
I see. Who do you live with, Mr. Blake?
I live with my family, my wife and 2
And
children.
I see. And are they supportive?
Yes,
Okay, that's very good to hear. So you told me you have this been you've been having this condition for about 6 months now. So has it affected your mood by any way?
no, my mood is fine.
Okay, that's very good to hear. So, Mr. Blake, do you have any other concern beside the drug you would like to be prescribed?
No, I want just you to prescribe to me Riluzole.
Okay, okay, no worries. Before we continue our conversation, I would like to examine you, check your vitals, and take some blood sample from you. Would that be okay with you?
All right, observations are normal, stiffness in most of the muscles in the body.
Well, Mr. Blake, after examining you, I noticed that you have this weakness in your body. You told me you want to be prescribed a drug called riluzole. Am I right?
Yes.
So do you have any idea about the indications of this drug?
No, I haven't read anything, but my friend told me it's really good.
Yeah, yeah, of course. Well, Mr. Blake, this drug is a drug used for neurological condition. However, I will not be able to prescribe it for you. It's also written only by the specialist. So how about I refer you to a neuro specialist? He will have a further discussion with you, do further investigations, and if you are eligible for this drug, he will describe it for you. How does it sound?
But I'm already going to the appointments, doctor. So I'm waiting for the next appointment. It's in 2 months. So I can't wait for 2 more months, doctor.
I understand your words, Mr. Blake, but this is for your safety, as
2 minutes
the specialist will
remaining.
be in the specialist will be in a better position to prescribe it to you. Are you following me?
Yes, doctor, but why my friend has been prescribed this medication?
I understand your words, Mr. Blake, but every condition is different from the other patient, and there are a few indications for the drug. So how about we, at the end of our conversation, open the BNF and read the indication for it, the indication for the drug together. Would that be okay with you?
It's okay, doctor. But I
Okay,
think
for
you
the
don't want to prescribe it just because it's expensive, right?
I understand your words. I'm very sure if you feel that, but as I told you, it is a treatment that only could be written by the specialist. It cannot be written in the GP clinic. Uh, are you following me, Mr. Blake?
I'm following you, doctor.
Okay. So in the meanwhile, until you've been seen by the specialist, how about we manage a plan? So can we manage this stiffness? Would you like me to tell you how we can manage that?
Yes.
Okay. For the meanwhile, Mr. Blake, I can refer you for the physio service, so we can do further exercises can help you with this stiffness. Do you think he can do that?
I'm already on physiotherapy and language therapy as well, doctor.
I see. That's very good to hear. So are you following? Are you going to them regularly?
Yes, I do, but I can't see any improvement at all.
Oh, I'm very sweet to hear that. Well, Mr. Blake, as I told you, your concern is valid, but the only problem is it is not going to be prescribed in the GP surgery. In the meanwhile, Mr. Blake, until you've been seen by the specialist,
Move on to the next station.
Thank you. Thank you, Dr. Ahmed, for your participation. So how do you feel quickly?
I'm not sure. This is the first time to see this case. It is not present in the course. So yeah, I'm kind of confused.
I didn't hear what you said, darling.
It is not present in the course, so I'm kind of confused. I'm not sure how I did it.
No, it's present. It's present, my dear. It's in the YouTube, in the channel. It's in
Oh, yeah.
Telegram channel. Yeah,
Maybe this is the problem. I didn't open the
yeah,
channel yet.
yeah. It's fine. It's totally fine. All right. Okay. So, even if you didn't hear about it, you can just fit the structure in one of the categories and then deal with the case. You dealt with it reasonably well. All right. And I'm going to comment on different parts on your performance right now. All right.
Okay.
Okay. Just give me a sec. This one. Where is it?
Begin.
Stop that. And find this one. Okay. So, do you still see the question?
Yes.
All right. So, let's first talk about what is the type of this case.
It's a concern.
A concerned patient. The patient is concerned about specific medication. He wants specific medication to be prescribed to him. All right. So, what is the first thing that you have to ask in this category? Why?
Is
Why? Can you tell me why do you want this? I can see that you are really concerned about this medication to be prescribed for you. Can you tell me what is the reason behind this, or have you heard about this before, or from where did you get to know about this medication? All of these are types of questions to ask why. All right? Okay, so this is a concern. Patient, what is the task in this question? Talk to him and
So,
address his concern. So you talk to him and you address his concerns. The main task is addressing his concerns. Whatever he has, whatever concern he has, you address it and you answer his questions properly. And don't prescribe riluzole to the patient. It is a specialist treatment. And you used this information in the question to be asked. Okay? You address my concerns, but the only thing that I can tell you in your performance which needs improvement is the interpersonal skills. You need to be more sympathetic and empathetic to the patient. You need to have more acknowledgement with the patient and showing that you are in the patient side. You tell him, all right, I can see how it is difficult for you. It sounds tough for you, and I know how you want this medication, but unfortunately, this medication should be prescribed by a specific doctor or the specialist because of what? All right? You told me that, but without showing feelings in your tone of voice. You were trying to tell me facts. Got me?
yes, yes.
Okay. So you have to play a little bit with your tone of voice and you have to be more sympathetic and empathetic with the patient. All right. In the body, I can't comment on the body language, but all what I can comment on is your tone of voice and your emotions in your way of talking. Okay. So this what needs improvement, Dr. Ahmed. Okay. So please
Yes.
work on this part, your tone of voice and your showing feelings while you are talking. Okay?
Well, I usually do that, but the as the first time I saw the case, it kind of shocked me. So
It's
maybe
fine.
that's the cause. Yes.
It's fine. It's fine. Okay? In terms of your interpersonal skills, you need to show more acknowledgement and more sympathy. All right?
Right.
In terms of your data gathering, your data gathering was organized and logic. Okay. You asked the some relevant questions. Do you think asking about diet is important in this case?
Maybe it's a counseling session. As I cannot manage his concerns, so maybe try to improve his lifestyle so he can cope better with his condition. That was what was in my mind at that time.
Okay, I do understand your perspective, but does changing the diet or eating healthy diet or unhealthy diet will be very, very relevant to motor neuron disease as a disease itself?
No,
No,
no, of course,
right?
no.
Yes. So always ask the relevant questions. If you ask me what are the relevant questions in personal, you can ask about smoking and alcohol can affect the muscles. Also, you can ask about sleeping, if this stiffness or this condition affects his sleeping or not. Is he taking enough time sleeping? All right, not enough time sleeping can cause some, problem in the muscles as well. All right, so these
Yes,
are the relevant questions in personal history if you would like to ask. All right. You in history taking, I would love if you don't miss asking about what is the management plan. He has been diagnosed and he is already going to a specialist. So what is his plan? It's not only medication. So what is he taking? Is he doing anything else? So he's going to the physiotherapy and he does go to language therapy in addition to the muscle relaxants. All right? So you ask him, what is your management plan? Can you tell me about what did they advise you, or what is the plan for management for you? All right? You also
All
need
right.
to ask about the symptoms, the general symptoms, not only stiffness or muscle. You ask him, what are your symptoms in general? Okay?
But Doctor, motor neurone is purely motor, so I wanted to ask about the sensory symptoms, but I knew that this condition is purely motor, stiffness, weakness. So I was not sure if is there any red flags that I should exclude in this case.
So you ask about the muscle. If you would like to ask yes or no questions or close-ended questions, you can ask about muscle weakness, muscle stiffness, and spasticity in addition to speech problems. Okay? But
Okay.
it's better always, especially if you don't know the medical condition, ask the patient, what are your symptoms exactly? Can you tell me what are the symptoms that you are suffering from? So we can help you with. We can help you in treating them. All right? This is what you missed. So what are the symptoms and what is the plan of management? Okay? In management,
Okay.
in management, well, you told me the fact that it's not my medication. It's not my duty to prescribe this medication, but you needed more sympathy and empathy to show. All right?
All right.
Okay. So this is what I can comment on your performance. Okay. Do you want to add anything, or do you want to
No, doctor, thank you.
Okay, Dr. Ahmed. All right. So this is we have talked about the comment and how we deal with the question in general. All right, a concerned patient, you ask the patient, why? Can you tell me why you are concerned about this specific medication? And then you tell him, all right, let me ask you a few questions. And in your history taking, you try to ask about usually in counseling, we search for risk factors, okay? Here, to be honest, in this case, it's a bit different from many cases. You don't need to ask about risk factors here. The patient doesn't really have risk factors except maybe, genetic disease or something like this, but you try to find out what could be worsening this condition and what are the symptoms that the patient has and what is his plan so you can add on in your management. All right? Psychosocial is
All
really
right.
important. Psychosocial is extremely important. Okay. Who does the patient live with? How has he been affected by this? And then your management, you telling the patient what's written here. And you have to show your communication skills. You can't say to the patient, okay, Mr. X, I'm really sorry, or I can't prescribe this medication because it's a specialist medication and that's it. Okay? You have to show your sympathy and empathy, your communication skills with the patient. Tell him, all right, Mr. X, I can see how you are struggling in your life with this problem, and it must be difficult on you. And I know how you want this medication, okay? But how much do you understand about this medication? I don't know anything, doctor. Tell him, all right, okay. So this specific medication is a specialist medication. It has many risks and many side effects, and the specialist should weigh out the benefits and risks. You should be monitored with the specialist every now and then. So that's why the specialist, the only one who can prescribe this medication for you. This is how to check understanding and to explain to the patient. with sympathy and empathy. You don't give facts to the patient. You sympathize and empathize during giving the facts. Okay, doctors?
Okay, doctor, thank you.
All right. Doctor, yes, you have to ask, guys. What's your ideas? Dr. Ahmed asked, how much do you understand? So this is the idea. Concerns, the patient is concerned about this. Expectations, you know what is the expectation. So ICE doesn't mean that you have to ask ICE as it is, but you can just modify the way that you can ask ICE with. All right? Okay, let's do the next case, doctors. Dr. Hajar, are you ready?
Yes, doctor. Okay.
Okay. Yeah, the last question, when the patient tells you, doctor, is it, you don't want to prescribe it because it's expensive? How to answer? You tell the patient, well, Mr. X, I'm really sorry that you felt that way, but this is not the case. We usually prescribe the medication, either if it's expensive or not. If it's once the medication is indicated, we don't look at the cost of the medication. But the only thing is that trilosol is a medication needs close monitoring with the specialist. All right, why my friend has been prescribed this medication? Well, your friend, maybe he has a different stage of this disease. That's why he was prescribed this medication. Okay? All right, let's do the next case, doctors.
Doctor, I have a question.
Can we ask the questions at the end of the session, if you don't mind?
Yeah, sure. Yeah.
Sure, just write down or just write it down in any paper, and I promise you I'm going to answer all of your questions. Okay, Dr. Hajar, let's do the case.
Mm. All right. Okay, doctor.
Ready?
Okay.
Are you happy to switch your camera on? I'm happy as well if you would like. If you don't, it's okay. It's totally okay.
Honestly, I just forgot about it. I didn't mind, but okay. Anyway. Just give me a second.
All right, no worries. Dr. Mustafa is asking, would we refer that patient to the specialist? The patient is already referred. You can speed up the next appointment. The patient is already referred. The patient has already had the first appointment. Okay?
Sorry, doctor. Is it two-way camera or just me?
Yeah, I didn't see you.
Okay, I just didn't see it. Okay, I now see you now.
I can't see you.
Yeah, I will open the camera.
I know.
I'm trying. Please allow Zoom workplace to access camera from device settings. Okay, so it's a problem with my device settings.
All right. If you can't, it's totally okay.
Yeah, it's
I'm
not
forcing-
working with
I'm
me
not
for me now.
forcing you.
No worries. Yeah, it's good because usually we're doing the sessions without cameras, so it was
If you would
yeah.
like, I
No
can
worries.
flip
Yeah,
you.
No worries, it's okay. I will start like this because I was stressed already. So, so
All right.
yeah, it's
No
okay.
worries. Okay,
All
I will
right.
use the camera as well. No worries.
All right.
Okay.
So we can start. Okay.
Okay. You still 2 seconds. You have 2 seconds to start. Yeah. Start.
Begin.
Hello, I'm Dr. Ismail, one of the doctors in the GP surgery.
Hello.
Are you Mrs. Lola Hassan?
Yes.
All right. Could you confirm your age for me, please?
I'm 30 years old.
All right. Can I call you Lola?
It's fine, doctor. Yeah.
All right, Lola. So I understand that you've been having some concerns. Am I right?
Yes, doctor. I want to change the counselor.
Mm-hmm. All right. So definitely I can do that for you. But before going further, could you tell me why you want to do so? And I'm sorry, just before asking, before that, what counselor do you talk about?
My counselor in the counseling sessions, I go to CBT sessions.
All right. Yeah, I can
Mm,
see that from my notes as
mm,
well. So
yeah.
you mean you want to change the counselor for your talking sessions, right? For
Yeah.
depression.
Yes.
All
Yes.
right. So could you tell me why you want to do so?
Uh, I don't like to do the counseling sessions with him anymore.
Mm-hmm. All right. So is there any specific reason you would like to change him or just like this?
Well, um,
Mm-hmm.
no specific reason. Doctor.
All right. So, okay, I will just go to this concern in a moment, but I would like to ask you, how are you doing with these sessions?
Well, it's okay. I'm improving.
Mm. How do you feel, mood-wise?
It was okay, but nowadays I don't think it's okay.
Mm-hmm. Okay. So regarding your depression, are you just doing counseling sessions, or are you taking any medications for it as well?
I was taking sertraline, but I stopped it.
Mm-hmm. So you stopped it by yourself, or the doctor stopped it for you?
The counselor told me to stop. He advised me to stop. My mood is okay now, so I
Mm-hmm.
stopped. Yeah.
So for how long have you been stopping it?
I'm not sure how long, doctor.
Mm-hmm. All right. So are you regular with counseling sessions?
Yes.
Mm-hmm. So any improvement from the counseling session, or you don't feel?
Yeah, it was. I was improving.
Mm-hmm. I'm sorry. Is there any specific reason you start to feel worsening or your symptoms back again?
I don't
Mm-hmm.
know. Doctor.
All right, Lola. I can
I
see that you're a
I
bit
just want to
uncomfortable.
see the counselor, please.
I can see, Lola, that you're a bit uncomfortable talking about this, but here, everything you're saying is kept confidential. So I believe there's no need to worry about anything. So we can help you with that, whatever it is.
I'm not sure, doctor, if I should talk about this or not.
There's no need to worry about anything, Lola. We're here to help you. So we will do our best to help you with any issue you're dealing with.
Well, I saw this counselor with another woman
Mm-hmm.
in the mall,
Mm-hmm.
and I felt that I don't want to see him anymore.
Oh, I see. So just please explain to me why you're concerned about seeing him with another woman.
Well, we were in a relationship, a romantic relationship.
Mm-hmm. Actually, I'm glad first that you opened up first. It takes a lot of courage to open up, right? But please, could you elaborate more about what kind of relationship you're talking about here?
Yeah, he hugged me and, you know, until the point that They were kissing.
Mm-hmm.
Yeah.
Mm-hmm. Okay. Anything apart from that? Have your relationship
No.
gone any further? All right. So, right. So there is no need to feel any guilt. This shouldn't happen in the first place, right, Lola? So, I would like to ask you a few questions. I understand this might be stressing you, but could you tell me how is this impacting you?
I just don't want to see him anymore. I
Mhm.
felt that it's wrong, and I don't
Yeah.
want to see him. Yeah.
Yeah. You did the right thing, Lola. So we're taking these kind of issues really seriously, and definitely we can help you with changing your counselor, right? But I would like to ask you, how are you feeling at the moment? Yeah, do you feel low or you okay overall?
I want to start the medication again because I don't feel good. Yeah.
Mhm. All right. So do you feel that your depression is affecting your life more recently?
Yes.
All right. Have you
2
lost your
minutes
interest
remaining.
on your, yeah, have you lost interest in your usual enjoying stuff?
Yeah.
All right, Lola. So what we can do for you now, I can definitely help you with changing counselor. And regarding starting you on medications, I can help you with that either, as long as you're feeling that things are not working really well with the talking therapy alone. And we will, as I mentioned, we will take this incident really seriously, and I will involve my seniors to get to, this kind of behavior shouldn't be happening in the first place.
What do you mean seriously, doctor? What are you going to do?
This incident should be investigated because we don't want this to happen anymore with any other patient. I'm sorry, you understand that as long as this happened with you, this can happen with any other patient as well, right?
Okay.
Yeah, so this counselor should be investigated, that this action should be investigated, and action will be taken, right?
I don't want to do any trouble for him. I just wanted to change him, doctor.
I really appreciate your concerns, but we actually, crossing the boundaries with patients is not acceptable at all. You were, liable. You were in a bad situation with depression. So he took advantage of this. He took advantage of the situation. So it's not ethical at all, and should, some investigation should be done, and some action should be taken regarding this, Lola. And I really appreciate your concerns regarding this. And we can definitely help you with some support.
Move on to the next station.
Time is up. Thank you, Dr. Hajar.
Thank
So,
you, Doc.
yeah, how do you feel?
All the best. I'm bad with time management, I know.
No, why? So what do you think that you wanted to say more than this?
I wasn't sure about starting medication. There are criteria for starting medication. I know how much is it affecting her life. I know, and maybe the counseling itself wasn't the problem. Maybe the counselor is the problem.
Yeah.
So
So what is your issue now? If you can't decide which part that you want to talk
yeah,
about,
I would ask her how much is affecting her daily life, how much it's her functioning is affected.
you asked me this, but
Yeah, but
if we weigh things and you try to weigh which part that I want to emphasize on and which part that I can just highlight. In this case,
Mhm.
what is the main issue that you have to deal with?
I'm not sure if this is a problem.
The
Like we're inside.
think
Yeah.
about it. Think about
Mhm.
it. Which one is it? The starting the medication. I mean, if the depression is the criteria of starting the medication or
Begin.
the action of counselor.
The action of counselor.
Okay. So you have to deal with it with this most importantly, and starting the medication, you can tell her, all right, we will go through some assessment for your depression again, and we can start your medication based on that.
Yeah, I can just verbalize it because it's
Yes.
yeah, it's good.
Okay.
Yeah.
So weigh up the things and the issues, and then you can deal with the case properly. All
All
right?
right. Okay, doctor.
Okay. If I would comment on your performance in general, what is the type of this case? Quickly, the type of the case is counseling
Addressing
concern.
concerns, yeah.
Yes, concern. The patient is concerned about a specific thing. You asked her why, and then in your history, it's not about risk factor here, to be honest. It's about the situation itself. Why she wants to change the counselor, what is the cause, and is she improving or not? What about her depression, is improving or not? And the situation itself with the counselor. You have to find out what happened exactly, all right? Why she is really concerned when she saw another person with him, and what happened, what is the actual relationship? Is it just hugging, kissing, and or talking, or it went to another thing, sexual or relationship or something like this? Is it against her will or not? Is it against her will or not? Then you talk about her depression. How does she feel about this? How is her feeling? And is her depression is getting worse? Any suicidal thoughts or not? All right. So
Yeah, I forgot.
these are the most important questions that you are keen to ask in this case. In terms of your body language, I can't comment on your body language, but I can comment on your tone of voice. Your tone of voice is proper. You can play properly with your tone of voice. You have well control of your tone of voice, and your voice is emotionful. Okay, so yes, good. Your interpersonal skills as well, very, very good. Well done. Sympathetic, empathetic, acknowledge, very good rapport, very nice, right?
Thank you.
Your data gathering, we have talked about your data gathering, what you have missed, all right?
Suicide, yeah.
Yeah. Management, in your management, you have to emphasize on that this action or this act should be investigated and reported. Okay, reported, investigated, and reported.
I said that with my seniors, but I should say reported.
No, just highlight investigated
Seniors.
and reported, and there are some actions that will be taken towards him. If she tells you what actions, tell her, all right, it's based on the investigations, based on the actions with every people, so I cannot estimate exactly what happened, but this action is unprofessional and it should be reported and investigated. Okay? In terms of her medication, you can tell her, well, okay, I can see there is worsening of your symptoms. We can assess you again and talk with your the specialist. Do you go to a specialist, or you are being treated here in the GP? So we can go through another assessment for your depression, and then we can restart the medication. Okay?
Okay.
That's it. But well done, Dr. Hajar. Yeah.
Thank you so much, doctor.
All right.
Thank you.
Good. So yes, let's do the next one, doctors. I just want to take more cases as much as we can. Who is ready? Let me see who is ready from the doctors. Dr. Ayat? Dr. Ayat Yusri?
Yes, doctor.
Yes. Can we do the next case, please?
Yes, okay.
All right. Happy to switch your camera on?
It's okay, yeah.
Okay, good. We have finished. Okay, and I'm going to switch my camera as well. Yeah, we are going to take follow-up cases, all right?
Okay.
Read this question, please.
Begin.
Okay, go.
Hello, I'm Ayat Lashri, GMC number 1234. Shall I proceed?
Yes?
Hello, I'm Dr. Lashri, one of the doctors here in the hospital. Are you Mr. Paul Bernard?
Yes.
Could you confirm your age for me, please?
54.
Yeah, so can I call you Paul for today?
Yeah, just fine.
Okay, so Paul, I understand that you've been admitted to the hospital 4 days ago after a heart attack. Am I right?
Yes.
Yeah, I'm sorry to hear about that. Must be very stressful situation. So, how are you doing now?
I'm doing okay. Better,
Yeah,
much more better.
I'm glad to hear about that. So, how's your hospital stay? Was it all right?
Yeah, good.
Any chest pain at the moment?
No,
Any leg swelling at all?
no at all.
Any shortness of breath?
No.
Yeah, that's reassuring. So, have you started some medications at the hospital? Are you aware of any of these medications?
Yeah, well, one of your colleagues told me about the medications that I'm going home with.
Yeah.
Aspirin, bisoprolol,
Mm-hmm.
simvastatin, and
Yeah.
some other medications, yeah.
Yeah. So, are you understand how to take these medications and
Yeah, they explained to me
yeah. So that's reassuring. So, may I ask you, is that the first time you experienced such a heart attack?
oh, well, yeah, it was the first time.
It's the first time. Yeah, I see. So, may I ask you regarding your general health? Do you have any medical condition of long term?
Just high blood pressure.
Yeah. Since when?
3 years ago.
Okay. Are you in? Were you on any medications for
Yes,
this?
Ramipril. Yeah, Ramipril.
And were you taking it as prescribed?
Yeah.
Mm-hmm. Any other regular medications apart from this?
No,
Any allergies?
no.
Okay. So, do you have any family history of any heart problems?
Not that I'm aware of.
Mm-hmm. So, may I ask you, what do you do for a living?
Well, I'm an accountant.
Yeah, and I see. And how did this affected you? I know that a heart attack, hospital admission, all of the sudden, maybe overwhelming. So, how do you feel, and how did it affect you?
Well, it was scary. Yeah, it was scary. Severe pain in your chest. You're about to die. But yeah, uh, all that passed.
Yeah, yeah, I see. I can imagine how stressful this could be. Could you score your mood for me from 1 to 10, while 10 at the highest mood?
My mood is okay, doctor.
Yeah, I am glad to hear about that. So, do you have enough support around you at home?
Yes, my wife is there, and yeah, she
I'm
supports
glad to
us.
hear about that. So, regarding your lifestyle habits may contribute to many things. Do you smoke?
Oh yeah, I smoke. I smoke 30 cigarettes per day since I
Yeah,
was teenage. Yeah.
yeah, I see. And do you drink alcohol?
No.
Mhm. What about your diet? Could you walk me through your diet?
My diet is not very healthy, to be honest, because my work, I always there in the office, so I eat fast food, usually fast
Mm.
food. Yeah.
Yeah, okay. And do you exercise regularly?
Not really.
Yeah, I see. Any reason for that? For not
I don't
exercising?
have time. I don't
Yeah, I
have time.
see. So, any ideas what might be causing this heart attack and what the causes of this?
No idea.
Any concerns at the moment?
No.
Okay, thank you, Paul, for answering all my questions. So let me examine you. Let me check your observations, including blood pressure, temperature, heart rate, and breathing rate, and check your chest, tummy, and legs. Would that be okay?
Examinations normal.
Thank you, Paul, for letting me examine you. So now I've been asked to talk to you, Paul, about what has happened and how we can modify our lifestyle just to prevent this from happening again. Are you happy to do this with me?
Okay, it's fine.
So first of all, let's see what the risk factors and what's the contributing factors that led to this heart attack. So the smoking is the main factor that contribute to such heart problems. So I highly advise you to quit smoking as you are smoking a considerable amount that need to be stopped. So how do you feel about this?
Okay, no worries. I can consider that.
And we can help you with that, and I can refer you to a smoking cessation clinic, and I can arrange a meeting to talk about this in specific. Would that be okay?
Yeah, no worries.
So I highly advise
2
you to.
minutes remaining.
Sorry.
2 minutes remaining.
Okay, so I highly advise you to exercise regularly. It will make a big change in your life. It will prevent this from happening again, as it will normalize the level of lipids. It will normalize your blood pressure and will change your life. Actually, can you do this for me?
All what I can is just walking. I can't do anything more.
Actually, walking for 30 minutes every day would be more than enough just to protect you from such things to happen again. Can you
Okay,
do this
so
for me?
when can I go to my work again, doctor?
Actually, you can go after 4 weeks after taking a rest, and you can go as soon as you feel comfortable as well, but avoid any extra effort.
Okay, and if I want to travel, when can I
It's
travel?
advisable to wait for 2 weeks before going for any plane travel. Yeah.
All right. Okay.
Okay. So, do you have any other concerns at all?
No, not
Okay.
currently.
So, I'd like to advise you regarding your diet. It's highly advisable to adopt a healthy lifestyle by eating a healthy diet, fruits and vegetables, and junk food actually contains high amount of fats that may contribute to another heart attack. So we don't want this to happen again. So by starting a healthy diet, you will be safe and you will avoid this from happening again. So can you do this?
Move on to the next station.
You, time's up. Thank you, Dr. Ayat. How do you feel?
I don't know.
Okay, so you've done it really well. Okay, you've done it well. All right. The only thing that I can comment on is just start with a very nice smile.
Yeah, I
Okay, I saw your anxiety from your facial expression once you started the case. Okay, just, just, just mask this anxiety with a friendly and nice smile. All right.
Mhm,
Hello, how are you, Mr. Paul? I'm one of the doctors here. How are you doing? Is everything okay? How's the hospital stay? All right, with a nice, friendly smile. This will mask all of your anxiety. All
mhm.
right.
Yeah.
Okay. Apart from this, you've done, I think, uh, most of the points that are needed in the case. You don't really need to ask about, oh, because the patient will take medications, then you can ask about allergies. You didn't check the patient's understanding about myocardial infarction,
Yeah.
heart attack. Okay, so
Begin.
you can ask the patient, how much do you know about heart attack and the risk factors of having heart attack? You asked him any idea about what might be causing this heart attack. So you can ask any idea about what is heart attack exactly. You can ask this. Other than that, I cannot say anything. The task, please talk to the patient, discuss with him lifestyle modification and address patient's concern. You talked to me, you took the relevant history, you explained to me the lifestyle modification, which is your task, okay? And you addressed my concerns, which were the work and the flight. All right? So,
Yeah.
well done.
Thank you. Thank you, Dr. Sahar. Thank you so much.
Yeah, keep up. Yes, keep up.
Thank you.
Okay, so yes, let's do the next one. Who's ready? In April, we finished April. In May,
I can do it, doctor, if you.
who is
Omar.
Dr. Omar Marwan, right?
Yes.
I can do with you, but let's
Yes.
see the other people who are having their exam sooner than you. Is that okay?
Sure. Sure.
Yeah, I will pick you up. I'm sure that you will be one of the doctors today. In May, we have Dr. Ala and Dr. Ahmed, 20th of May. Dr. Ala and Dr. Ahmed. Any one of you want to participate? You've written your names.
Yes, doctor.
Who is?
Ahmed.
Dr. Ahmed. Ready?
Just need a minute.
Okay. Just to remind you, these two cases are follow-up cases. All right, the previous one was following up, reviewing a patient. The structure is the same as we've talked about
Yes.
from the start. And this one as well, with some modification, we will talk about it.
Okay, we can begin.
Okay.
Begin.
Hello, I'm Dr. Al-Maghrabi. I'm one of the junior doctors in this department. Are you
Hello.
Mr. Paul Bernard?
Yes, doctor.
Could you confirm your age for me, please?
I'm 15.
Okay, so may I call you Paul?
Yes, it's fine. Paul's fine.
Okay, Paul, so I can see from my notes that you've had a bunch of strokes lately. So what seems to be the problem? When did this happen?
Well, I had a few attacks of facial weakness and arm weakness in the left part of my body. And it was 3 times, yeah, 3 times.
When was the last time this happened?
The last time was 1 month ago.
And how long would you describe your attacks for me? How long did they take?
The attack itself,
Yes.
15 minutes.
Okay, so what happens during the attack?
Facial weakness and arm weakness.
Okay, does anything else happen?
Nothing.
Okay. Are these attacks similar? Like, or do they get worse every time?
Well, no, the same. I don't have symptoms now. I'm okay.
What were you doing when these attacks happened?
Well, I was just sitting down watching the TV.
Okay, so when you went to the hospital, what did they say you had?
Mini stroke.
Okay, did they give you anything for it?
Yes, some medications, aspirin, clopidogrel, and blood pressure medication, and I'm taking them as prescribed.
Okay, and did they run any investigations on you, any tests?
No,
Okay, how are you feeling now?
I'm feeling okay. I don't have any symptoms.
Okay, that's good to hear. Okay, so how did you get here today?
With my car.
Okay, well, so I'm now going to ask you some questions about your general health to get a better understanding of what's going on here.
All right.
So, other than these 3 episodes, did something like this happen before?
Sorry?
Other than these 3 episodes, did something like this happen before?
No.
Okay. Does anyone in your family have history of strokes?
Yes, my dad had stroke.
Sorry to hear that.
Yeah.
Okay. So, do you have any medical conditions right now?
Just the mini strokes.
Okay, so you don't have any high blood pressure?
No.
Okay, so are you on any medications?
Yes, as I mentioned,
Other than
clopidogrel,
the ones that
aspirin.
doctors prescribe for you?
No.
Okay. Do you have any allergies?
No.
Okay. So you mentioned that you drive. Yes.
Yeah.
Did any of the doctors discuss your driving with you?
Well, they told me not to drive for 3 months. Yeah.
Okay. So do you live with someone?
Yeah, I live with my wife.
And could you say that she's been supportive of you lately?
Yes.
Okay, that's good to hear. Okay, so I'm now going to ask you some questions about your lifestyle. Is that okay with you, Paul?
Okay.
So do you smoke?
Yes, I do smoke.
How much do you smoke?
20 cigarettes per day, but they told me to stop. And to be honest with you, I stopped.
Okay, that's good to hear. So what about your drinking? Do you drink alcohol?
No.
Okay. What's your diet like generally, Paul?
My diet is okay. I'm trying to eat healthy and following the advice that they told me.
Okay, that's very good. And do you exercise regularly?
Yes, I do walk every day.
Yes, very good. Okay, so how has this been affecting your life lately, Paul?
Well, not really. I'm okay now. Yeah,
Okay,
doesn't.
so do you have any idea what could be causing this?
Yeah, they told me that there is blockage of the blood supply to my brain just temporarily, and yeah,
So are you concerned about anything in particular?
no.
Okay, so what do you hope we do for you here today, Paul?
Nothing. It's just a follow-up. I came for my follow-up.
Okay, so I'd like to examine you. Is that okay with you?
Okay.
I'd like to check your heart rate, your blood pressure. I'd like to check your temperature, your oxygen levels. I'd like to check your breathing rate.
Okay.
I'd also like to do a neurological exam on you.
All right. Examinations are normal.
Okay. Okay, Paul. So as the doctors have told you, you have a condition called the mini stroke. It's a very temporary interruption or blockage of the blood supply to your brain, which causes the symptoms you've had. There are many factors that could contribute to this.
Minutes remain.
You've been smoking a lot, and also your history with your father. This could also contribute to your case. But other than that, so this is a condition that we actually need to address early on, so it doesn't become anything worse. So it doesn't become a full-blown stroke.
Okay.
Okay, so I see that you've been really just following your medication, what your doctors have told you, and that's really good.
Mm-hmm.
There's something in particular I just gonna have to discuss with you, Paul. The doctors told you to stop driving for 3 months. And you just told me that you came here by your car today. Why didn't you stop?
Because I'm a taxi driver and this is my work, doctor.
Okay, but this is actually a serious condition, Paul. You're gonna have to, we advise you to inform the DVLA, and you can be driving a taxi right now.
Well, doctor, this is my work. How can I feed my children? Don't you have children, doctor?
I'm really sorry to hear that, Paul, but it's actually a serious condition. You could have a mini stroke like this while you're driving, and this could cause harm to you and to others. You could go into an accident. That's really not something you'd like, is it?
I don't know, doctor, but
I'm really sorry, Paul, but we're gonna have to inform the DVLA because we asked you to do this before and you didn't.
and if I don't inform the DVLA, would this be a problem?
Actually, Paul, yes, if you don't inform the DVLA, we're gonna have to inform them, and I'm really sorry about that.
You guys don't feel people. This is my work.
Move on to the next station.
Could have addressed this a little better.
All right. Thank you. Thank you, Dr. Ahmed. So
Thank
how do
you.
you feel?
I don't know. I think for management, I didn't cover his concern as much. If his last question, I should have answered it a little more earlier, but I also think I've asked about some irrelevant data or like redundant in my history.
Irrelevant. Irrelevant?
Well, not irrelevant. I just asked about his idea, and he already told me that he had a mini stroke. I asked about his concerns, and I already know him. Not really sure. I also asked about his medications, and I'm supposed to know them from my data.
Well, asking about medications is okay. I'm not concerned about the medication, but
Okay, that's
I am
good.
concerned. I'm concerned about asking what happened before. I mean, what happened in the 3 visits? Did it last for how many minutes? And the symptoms are worsening and these things. He doesn't have symptoms now, all right? The
Okay,
patient has been already diagnosed by TIA, right?
yeah.
So, will asking about what happened help you in the situation today, in the
Well,
management?
not really, but I just thought that I should ask about this even briefly, so there's not something missed or anything.
In counseling cases, no, you have 8 minutes
Okay,
to manage to do the most important things during 8 minutes. So just weigh up the most important things and the less important things. Okay? If we
okay,
think about talking about driving and asking about the previous symptoms, which one
yeah. Of course, the
you know,
driving's more
take the
important.
upper hand? Driving. This is your task. Talk to him about driving.
Okay,
All right. So the task is talking to him about driving. So once he told you, I came with my car, then you can start talking about driving. If you would like to do that, if you want to be systematic and then talk about driving at the end, it's fine, but you have to talk about driving. All right?
okay,
Okay. So asking about previously what happened, how many, what happened during the attack and after, before, and what were you doing, and these things. No need in this specific case, in this particular situation. All right?
okay,
Okay. Your task is talking about driving, so you have to talk about driving. Emotionally, if I could say about your body language, you need more interaction. So don't take me wrong, all right? But I will try to give you some tips just for, for you. I'm not criticizing you at all right? So the body language, your facial expression should be more expressive, all right? I felt your face is a little bit emotionless, all right?
Okay.
So you have to play with your, facial expression. Tell him, oh, I'm really sorry to hear that. It must be difficult. I know how it's difficult. And some facial interactions, all right?
I was trying to hide how nervous I was. I guess I hid all emotions.
Try to do that in front of the mirror, just 10 minutes every day. Talk to yourself, just to train yourself on your facial expressions, all right?
I studied a lot. Was this really a problem, or is this more in my head?
No, I didn't feel that at all.
Okay, that's good.
I didn't feel that at all.
Yeah, that's
All
actually
right?
really good.
At all. It's just, about your facial expression, just,
I'm gonna have to work on that, I
Yeah,
guess.
all right. You have a
Thank
really
you, Doc.
nice smile. You have a really nice smile, okay? It's just, you can work on yeah.
Okay, thank you.
Okay, thank you. Interpersonal skills, well, you acknowledge, all right? But you don't have a little, you need to show some feelings while you are talking, all right? This is the most important thing in your interpersonal skills, all right?
Okay.
Oh, expressive face, all right? The tone of voice as well, playing with the tone of voice, okay? This will come with some practices every day in front of the mirror, okay? Loud voice and then go down by telling, well, okay, Mr. X, I'm really sorry to hear that. It must be difficult, okay? This exercise will help you to improve more your facial expression and your tone of voice, okay?
Okay.
Data gathering, as I mentioned, talking about the previous things, no need. Asking about family history as well, not relevant to this situation. Your main task is talking about the driving, okay?
Oh, of course, yeah.
So no need for talking about family history. Your management, you asked me about how much do I know about TIAs, and my lifestyle is okay. You tell me, okay, I'm happy that you are following the good lifestyle, and you are taking your medication as prescribed. This is a good thing. Please keep doing that. But my concern is driving, and then you talk about driving.
Okay.
All right. Okay.
Thank you.
So the patient should stop driving, and you have to tell him why. Ask him why you can't stop driving. I told you, it's my work. I can't feed my children. Then you show sympathy and empathy. You showed your sympathy and empathy. You told me, oh, really, I'm really sorry to hear that, but it must be, you give me facts instead of just, more showing me more sympathy. You tell me, okay, I'm really sorry. It must be difficult. I know how it is important for you and for your family as well. I know how it will affect you financially. All right. I'm in your side, but do you know what will happen if you drive while you have just had one attack 1 month ago? You might have another attack, and it will be unsafe for you and for the road users as well. Do you get my point, Mr. X?
Yeah.
All right. More sympathy and empathy. Okay.
Okay.
All right. Good, Dr. Ahmed. Good attempt. Just, try to understand what is wanted from you in the situation, and then you will be able to take your data based on that. All right?
Okay.
Okay. Got it?
Yeah, thank you.
Thank you, Dr. Ahmed. All right. Let's do the next case. Who is ready?
Yes, doctor, I'm ready. Dr. Ala.
Dr. Ala. All right.
Thank you.
Thank you. we are going to do follow up with new or worsening symptoms. Okay?
Okay.
Yeah. Read your question. Just remind yourself, doctors, new follow up with new symptom or worsening symptom. This means that you have to ask about something which is exploring the symptom. After that, you find the risk factors, you check understanding of the patient, and then you counsel the patient.
Begin.
Start.
Hello.
Hello.
Hello, my name is Dr. Fadlallah, one of the doctor in the GB surgery. Nice to see you today.
Oh, hello. Hi. Thank you.
Okay, could you confirm your full name for me?
I'm Ranjit Singh.
Okay, can I call you Ranjit for today?
Yeah,
Could you confirm your age?
27, doctor.
Yeah, thank you for coming for the follow-up. I understand you've been recently diagnosed with epilepsy, is that right?
Yes, doctor.
And how you doing?
I'm doing okay. I'm taking my medications and I had 2 attacks afterwards, and I don't know what's
Okay, I'm
reason.
really sorry to hear that. So you had 2 attacks after you've been discharged from the hospital.
Yeah.
Could you tell me more about them?
Well, I had them last week. I
Mhm,
was in parties with
mhm.
my friends, and then I had the attacks there.
Okay. And for how long it lasted?
2 minutes.
Okay. And do you experience any aura or any feeling before it?
No,
Did you recover yourself after the fit?
my
Okay.
my friends helped me and then brought me to my home.
Okay, must be hard for you. And the second fit, could you tell me about it?
The same, I was in another party.
In a
And
party, so both of them. And any of them require you to go for the hospital?
no, I didn't go.
Okay. And what your friend did after that when you were having the fits?
What do you mean?
So what they did? Did they are aware of your
Yeah,
condition?
they aware. I told them what to have to
Okay,
do.
that's good to have some people around to support you. Okay,
Yeah.
that's good to hear. Okay, so just I would like to ask you a few questions regarding your general health, and we'll try to discover why you got those fits after you discharge. So tell me, do you have any long-term medical condition at all, apart from epilepsy?
No, just epilepsy.
And do you okay, and do you know what's the medication you are on?
Sodium valproate
Okay, can you tell me how you take them now?
once a day.
You take them once a day. Okay,
Yeah.
this is a good point. I will come to this. Okay. And do you have any allergy at all?
No.
Okay. So the lifestyle will be very related. So could you tell me, like, you mentioned to me that you got those fits while in a party. So how frequent that you going to the parties and exposed to flashlights and loud lights?
Well, not very frequent. It was just, 2 times since maybe months.
Okay, 2 times. Okay. So what do you do for a living?
I am a taxi driver, but they told me to.
Taxi driver. Okay. And are you still driving?
No, I stopped.
You stopped. Okay. Okay, that's good. Okay. So do you take your meal on time regularly?
Yeah,
Okay. And do you exercise regularly?
yes.
Okay. What's kind of hobbies that you usually do?
Swimming.
You swim. Okay. And are your do you swim yourself or do you have any coach to supervise you?
The supervisor know about my condition, and they know how to deal.
They know, they are aware. Okay, that's good. That's very good. Okay, and okay, so okay. Just to ask you, like, do you smoke?
No,
Do you drink alcohol?
just occasionally.
Okay. I would like to ask you, do you know what epilepsy is?
Yes, they told me about the charges in my brain, and my brain has extra charges, so that's why I have epilepsy.
That's causing the fits, right, right. Okay, do you have any worries at all?
I just want to know why did I have these two fits.
Okay, okay, definitely. Okay, do you have anything that you want us to do for you today?
Nothing specific.
Okay, thank you for answering my question. I would like just to do a quick examination, double check your temperature, your heart rate, your breathing rate, and I will do general examination on you.
Okay, examinations are normal.
Okay. Okay, so thank you for letting me examining you. Your examination is totally normal. So as you mentioned to me that epilepsy is the condition of the brain while someone experience like abnormal electrical activity, and it's a manageable condition. With a medication, you should be able to live normal life. The thing that when I have a chat with you today, you take the medication only once a day, and
2 minutes
the right
remaining.
thing to take the medication is you should take it twice a day. So you take it every 12 hours in the same time, preferably.
Ah,
That
okay.
could be the reason that you had the fit.
Okay.
Okay, so okay. Do you have any question at this stage?
No.
Okay, so another thing is there is a risk factors that could trigger the epilepsy episode, like flashlights, loud musics, and long screen time, and not eating a meal or a meal on time. Like if someone is not eating on time, it could be staying hungry for a long time. It could be trigger as well. So it's very advisable for you to watch out for these triggers and try to minimize anything that you feel it's trigger your fits.
Okay.
Are you following?
Yes, doctor.
Okay. So okay, so and you mentioned to me that your friends are aware of your condition and they help you when you had the fit. That's very good. But it's very important, like, to avoid risky activities. You swimmed and your coach is aware. That's very good, but it's very important to avoid any risky activities, because if fits came, it will be very dangerous for your health, for your life.
Okay. All right.
Okay, and I'm very happy that you stopped driving. That's very good, because it's not safe for you to drive.
Okay. Yeah.
Okay, do you have any question at this stage?
No, doctor, thank you. You covered everything.
Okay.
Move on to the
Okay.
next station.
Thank you. Thank you, Dr. Ala, right?
Yes.
Thank you. So how do you feel, Dr. Ala?
I don't know.
You did it well. You did it well, to be honest. You missed a few things. We are going to talk about them quickly.
Okay.
So, if I talk about the type of this question, what is the type?
It's a medications review.
It's reviewing with new symptom, right?
With new symptoms, yes.
Reviewing with new symptom. The patient came in for following up and he has new symptom. So you have to explore the new symptom, what happened exactly, and are they the same as the previous one before diagnosis? And is there any injury after the attacks? And that's it. This is in terms of exploring the new symptom. And then while you are taking your history, you are searching for the risk factors of having attacks of epilepsy, right?
Right.
So, yeah. So this is the type of the question. What is the task? Please talk to the patient. Take relevant history. You took a relevant history. You missed a few things. I'm going to talk to you what are they and address his concerns. He has some concerns. To be honest, I didn't, in this particular case, I didn't raise any concern. All right, but sometimes the patient tells you, doctor, I have headache after taking sodium valproate. Then you tell him, all right, since when you have these headaches, do you have any blurry vision or anything affecting your vision at all? No. Did it start after only taking sodium valproate? Yes. Then you tell him, all right, it takes time. Sometimes it's a side effect from sodium valproate, but it will go on its own. But if you have any attacks afterwards, you can just take paracetamol or ibuprofen, right? This is if he raised this concern. You have just to make sure that it's not something serious, a serious cause of headache. Yeah.
Okay.
What else? So this is your task. You've touched on the task. Yeah. In terms of your body language, I didn't have the opportunity to see your body language, but from your way of talking, your tone of voice is really nice, matching the situation. You have a good control on your tone of voice, and I'm sure that you are controlling your facial expression. Interpersonal skills, you sympathize, empathize, you asked eyes, you acknowledged, everything was okay. Data gathering, it was organized, relevant. The only thing that you missed in history taking is asking about the home condition and who does he live with. If he lives alone, and the home condition, this is part of your safety.
Okay.
All right, so this is what you
Yeah.
missed. In management, you missed talking about home condition as part of the safety. He already told his friends how to deal, so no need to teach him how to teach people. That's it. But good. Yeah.
Yeah, thank you very much.
Well
Thank you
done.
for this opportunity. Thank you.
Thank you. Thank you. So what will happen now, doctors? We will have a 5 minutes break, but before the 5 minutes break, please, I'm going to share with you a poll. Just take 3 minutes to fill the poll. It's really important for me to find out your feedback, just for me to, do some adjustments, improve if there is need for improvement. It will really help me, okay? So yeah, 3 questions. Just write down your thoughts in 3 minutes, and that's it in this 5 minutes. All right. After that, we will have the next 3 cases. All right. I can just write down here. Break. Insert and write. Shape. Let's see. Yeah. Break. Dr. Nada wanted to ask something.
Oh, hello, how are you?
Hello, darling.
Okay, so I thought the session is at 1, not at 11, because my exam is after tomorrow and I was studying. So I was wondering if you can just share the name of the stations that were covered today so I can just see their mind maps and focus on them.
Can you say that again? Sorry.
Oh, okay. Because I missed the session because I thought the session is going to start at 1.
Oh,
So I wanted to know the topics that I missed so I can revise
mhm.
them as my exam is on Wednesday, inshallah, after tomorrow.
Oh, inshallah. So
Mm,
I will share the video. Okay,
okay.
if you want to watch it, I will share it on the YouTube, inshallah.
Mm.
Today, hopefully today. Okay. And yes, I can share with you on the group what are the stations that we have discussed. No worries.
Okay, and they all have the mind maps on the portal or not yet?
The mind maps.
Yeah,
What do you mean?
your mind maps on the portal.
Yes, they are on the portal.
Oh, okay. Yeah, that's what I wanted to know where to find them. Yeah, thank you.
Okay, all right. All right. Okay, darling. Yeah. So we will have a break, and then we can restart again. I will answer all of your questions after finishing the 3 cases, all right? Just please don't forget to participate in the poll, all right? Can you hear me?
Yes.
Okay, good. So thanks for the people who have participated in the poll. All right, I will see your comments and hopefully your suggestions as well, and we can accommodate them if they are applicable, inshallah. All right, I will end the poll now. Yeah, and I just wanted to share with you, I've seen many messages during the break talking about the course and the prices. So just quick few minutes telling you that the Eid offer is finishing at 3 days. All right. This is the price, the normal price, and we have 50% off on a single prescription. So instead of 300, it will be 150 for single prescription, and 65% off on group of 5 for the full course. Instead of 200, it will be 100 each in any group of 5. This is for the full course, okay? The practical course is not in the offer, all right? 3 days left, inshallah. This is the first thing. And the second thing is anyone who didn't attend the introductory session about PLAB 2 or CPSA, please be advised that our batch of Mentor Shield practice will start this month. 3 months batch, 3 months. We will start on 18th, the first Mentor Shield practice session in our course, in the full course, will start at 18th of April. All right. So please join us 1 week before the session just to start with us the batch. 3 months, and we will complete everything with the practical part as well. Practicing, okay? Studying and practicing. All right? Practicing with the mentors. Okay? With mentors. Yeah. And what else? Anything else that I wanted to tell? I think these are the things that I wanted to emphasize on. And let's talk about the core of the session, which is the counseling cases. All right. Dr. Nada. Dr. Nada, are you here?
Yes.
All right. You've written your name in the Facebook, and I didn't remember that you've written your name, so I can't pick you up this the next case if you
Yes, yes, I would love that.
all right. Okay. You've written your name with Dr. Ahmed. Sorry, I'm reading.
Mhm.
I didn't remember that.
Begin.
Nada Abdu, GMC reference number 79288781. May I proceed, please?
Yeah.
Okay. Hello, this is Nada Abdu, one of the foundation doctors here in the pain clinic. Am I speaking to Mrs. Jane Rosemary?
Yes, doctor.
Can you please confirm your age?
I'm 60 years old.
All right. Is it all right to call you Jane?
Yes, Jane's okay.
Okay. So Jane, I can see from my notes that you came from the oncology department
Yeah.
and you're experiencing some pain. Is that right?
Yes, doctor, I have pain in my back, in the lower back here for a few months now, and it's getting worse. Yeah.
I'm sorry about that. Are you currently experiencing pain as well?
Yes, but I can manage.
Okay. So please tell me, when did this pain start?
Well, it's for a few months now. I don't know if you know, I had breast cancer, and it's in the late stage. I had mastectomy, but doctors told me that there is metastasis to the bone, and that's why I have this bad pain. Yeah.
Yeah, I'm sorry about that. And how is your mood?
My mood is okay. I'm okay. My mood is not affected.
Yeah. Do you think you have enough support?
Yes, doctor. Yeah.
Okay. Please let us know if you need to do further arrangements regarding the support. But
Yeah.
for now, I would like to ask you about the pain. Is that okay?
Yeah.
Okay. So you said it started a few months ago. And you have breast cancer 5 years ago, and then you had a mastectomy, and then you were told that the cancer has spread to the bones. Is that right?
Yes. Yes.
Okay. And is the pain just in your lower back or is it somewhere else?
In my lower back.
Okay. And how would you describe the pain, as in the character of the pain?
Well, it's aching. I'm not
Mm.
sure. Yeah.
Mhm. Is there anything that makes it better?
Nothing. Yeah.
Is there anything that makes it worse?
Mhm.
Okay. And if you were to scale that pain from 1 to 10, 1 being the most bearable and 10 being the highest and worst imaginable pain, how would you score it?
It's 5, doctor.
It's 5. It sounds like very painful. I'm sorry about that. So how is your bowel movement? Do you go to the toilet okay?
Yeah, yeah, I don't have any problem with that.
Okay, and how is your urination?
Okay.
Okay. Does does the pain spread down your thighs,
No,
spreading to the buttocks?
no,
Okay. Does it sometimes feel electrical in nature?
no,
Okay. Have you noticed any changes in your sensation in your legs, such as having numbness?
no,
Any pins and needles sensation?
no,
Okay. Did you experience any fever recently?
no,
Okay. And do you have any other symptoms besides the pain that you'd like to share with me?
no, just the pain, doctor.
Okay. So do you think that this pain is caused because of the spread of the cancer? Is that right?
Yes.
Okay. Do you have any other concerns you would like to share with me?
Well, I'm on paracetamol and it doesn't help. So I
Mm-hmm.
just need to take anything which can be helpful in improving.
Okay. Can you tell me all the list of medications that you're on?
Just paracetamol.
Okay. And do you have any allergies?
No,
Okay. Do you have any expectations from today's visit?
just any painkiller that can
Okay.
help me in that.
Okay. So I would like to examine you. I'll take your observations, which include blood pressure, heart rate, temperature, respiratory rate, oxygen saturation, as well as doing a general physical exam as well as a neurological exam. Is that okay?
Normal.
Okay. I'd also like to check your back if that's okay.
Back is okay.
Okay, good. Okay, so Jane, good thing is that your examination is normal. So I would like to prescribe you some medications for the pain. What do you think about that?
Yes, please. What
Okay.
medication that you are going to give me?
Okay, so you mentioned that paracetamol is not working. So I was going to prescribe for you something stronger.
Mhm.
I was going to prescribe you, we can start with an attempt of non-steroidal anti-inflammatory drugs.
I
Are you?
tried it, doctor, but it's not helping.
It wasn't helping?
Yeah.
Okay, so you need something stronger then. What do you think of codeine tablets?
Well, I've heard about codeine that it causes
Mm.
drowsiness, and I'm really concerned about this drowsiness.
It can, yes, cause drowsiness, but we can adjust the dose. However, I need
2
to make
minutes
sure
remaining.
that you are drinking plenty of fluids and eating well, because sometimes codeine can cause constipation.
Yeah, but how can I cope with drowsiness? I'm really concerned if I get drowsiness, doctor.
We're going to start with a low dose,
Mm-hmm.
and then we can follow up with you if
Mhm.
the pain is controlled or not. If it's not controlled, we will try increasing the dose gradually, and we'll keep following up with you until we get the right dose. What do you think about that?
Okay. And do you think that I'm not going to have drowsiness with this low dose?
You can take the medication before bedtime. So
Mhm.
if it causes drowsiness,
Mhm.
you would already be asleep and resting well. What do you think about that?
Okay, no worries.
Do you normally have problems with sleep?
Not really. No.
Okay. And is your eating habits okay? Are your eating habits okay?
Yeah.
Do you go to the toilet normally and have normal bowel movements?
Yes.
Okay. Please seek medical assistance immediately if you start experiencing constipation or, as you mentioned, the drowsiness. If you think that the drowsiness happens in the middle of the day,
Mhm.
even if you take the medication at bedtime, it's
Mhm.
important that I tell you about safety precautions so we can help you and adjust the medication. What do you think about that?
Okay. All right, doctor.
Okay, do you have any other questions for me?
No. No, thank you, doctor.
Would you like me to recap everything we've discussed today in our visit?
No, thank you, doctor. Everything is okay. But do you think that I will be able to look after my grandchildren while taking
Move on to the next station.
times up?
Okay.
Thank you, Dr. Nada. Thank you so
Okay.
much. How do you
Mhm.
feel?
I think I did okay, but I didn't safety net the codeine well and didn't really address the drowsiness part because I wasn't sure if it's taken once daily or twice daily.
Well, okay. You can start by once daily as she's concerned about drowsiness. All right. This is the first thing. Secondly, she was concerned about I've tried to prompt you drowsiness, drowsiness, drowsiness. Ask me, so why are you concerned about?
Oh, yeah. I didn't ask about that.
Right? So once the patient is raising a specific concern, always explore what's in his mind. Why is he concerned about this? Why? What's the reason behind this concern? All right? There's something will be raised up, okay? And then you can either reassure the patient or give an advice based on that, okay?
Yeah.
So the patient is, you know, concerned about drowsiness because she looks after her grandchildren. So will that affect her grandchildren? Then you can reassure her if she takes only once with low dose. We can start with low dose. If she feels that she's drowsy, we can
Begin.
talk about another medication. All right?
Yeah, why I didn't ask that? I was just concerned about the safety netting that I ignored the patient.
All right. So don't ignore the patient. Put the
Mhm.
patient in your center, and that's it.
Okay.
But in time, so let's talk about the marking or the what you've done and what you missed. So what is the type of this case?
It's a follow-up
Yes,
case
it's a follow-up case with
with a new symptom.
a new symptom. All right.
Mm.
Or worsening of back pain. Okay, new
Mm.
symptom or worsening of back pain that she has. So you have to explore the pain
Mm.
really well to find
Mm.
out, is it something related to cauda equina, fracture of the bone, she has metastasis, the bone
Mhm.
will be fractured and causing cauda equina. So you have to explore the pain very well and exclude cauda equina. And then what's your task? Please talk to the patient, outline a treatment plan, and address her concerns. You talk to the
Mhm.
patient and outline
Mm.
the treatment plan. What is your plan in this case? Giving the appropriate painkiller and
Mm.
what? Something else beside the pain. The patient has chronic back pain. Do you think that she will benefit from physiotherapy?
Yeah, she could
Yeah,
benefit from
yeah,
physiotherapy. And
yeah.
also I should have prescribed for her bisphosphonate so it can improve her bone structure.
Yes.
Yeah.
Yeah. All right. So these are the things that you can
Mm.
say. You can also
Mm.
advise her on packs, ice packs or hot packs, not ice, hot packs on her
Mm.
back. All right. Some yoga, massage,
Mm.
all of these can help
Mm.
as a pain management.
Mhm.
So her concern is the pain. So always think about what could be happening to the pain as a pain clinic doctor. So what I can do to the patient in improving the pain, I will prescribe her painkiller, which is appropriate. 5 routine can be helpful. If it's 7 or more, you can prescribe morphine. All right.
Mhm.
It depends on the pain severity. I can send the patient to physiotherapy and CBT as well if it's affecting her a lot. Bisphosphonate as well as a doctor and what the patient can do for herself. You know, hot baths, yoga, massage, all of these can help in the pain management.
Okay.
All right.
Yeah.
This is what you missed in the management part. In
Mhm.
the history taking, you didn't miss an important thing, to be honest. You did ask me about the effect. Did you ask me about the effect of this problem on me in the psychosocial part? No, effect.
Oh, so what do you mean by effect? I only asked about the mood and the
How has she been
psychosocial.
affected? I mean, how has she been affected by this in her daily life?
Mm.
If she's less than 60 in her job as
Mm.
well. Okay, so
Okay.
effect of this problem on her life and job, in addition to mood. So you just used the mood and you didn't ask about the others. This is what you missed in the history taking. So
Yeah.
history taking and management, we've talked about the what you missed. I would love if you just, do an X-ray, order an X-ray just to be safe. Maybe there's a fracture. Yeah.
Mhm.
Yeah. Uh, that's it.
Okay.
All right. So
Yes,
yes,
thank you.
thank you, Dr. Nada.
Mhm.
All the best, inshallah. Just,
I hope so.
keep up the good work. All
Mm.
right. So we have finished the 2 cases of follow-up or reviewing with new case or worsening of a presenting or existing symptom. All what you need in addition to the general structure is exploring the new symptom or the worsened symptom. Okay. All right. In terms of understanding, if we can use the understanding of the patient. How we use understanding? And can we ask the patient, what's your understanding of back pain management or chronic back pain management? Do you have any idea about what could be the treatment or what could be the medication that you can take if paracetamol is not helping? All right, this is how to use the understanding. Okay, let's do the next case. Let me see who is ready. I will answer all your questions at the end. Don't worry, doctors. Dr. Omar. Dr. Omar, we have taken Dr. Ala in May and Dr. Ahmed in May. We have Dr. Omar in June. Are you ready, Dr. Omar? Dr. Omar? Hello? Okay, he's not with us today. Now, who is the next? Dr. Mustafa?
Yes, doctor, I'm here.
Ready? You're in May. Sorry, I missed that.
Okay, no problem.
No worries. Dr. Mustafa, we are going to perform a case of medication counseling, all right? In medication counseling, we have either explaining a new medication to the patient or reviewing a medication, okay?
Okay.
All right. So read your question, please.
Begin.
Hello, I'm Mustafa, one of the doctors working here. Are you James Smith?
Yes, doctor.
Okay, could you please confirm your age for me?
I am 80 years old.
Okay, James, nice to meet you today. So I understand from my notes that you are here today for a follow-up, is that right?
Yes, doctor.
Okay, and I also understand that you have been diagnosed with a condition called polymyalgia rheumatica, is that right?
Yes, doctor.
Okay, so just to check what you have been told so far about your condition, could you tell me how much do you know?
Well, they told me that I have this condition and I have to start on corticosteroids and
Yes.
on them for like 4 weeks now, or 5 weeks, as far as I remember. And my symptoms are okay now. I don't have any symptoms. The pain is okay.
Yes, all right. That's good to hear. So do you know what exactly that condition means?
Yeah, they told me it's kind of inflammation of the muscles around the joints. Yeah.
Yeah, that's right. So let me explain it more to you clearly. So polymyalgia rheumatica, it's a chronic condition. It's kind of a chronic inflammation of joints and muscles. And it's kind of an autoimmune condition. That means the immune system is going against your body. And that's why that's the cause for the symptoms you have been experiencing. Is that clear, James?
Yeah, it's clear, doctor. I just want to ask you if I can stop corticosteroids, doctor.
Well, I can see that you're willing to stop your medication. May I know if there is any specific reason for that?
The symptoms are okay now. I don't have any symptoms, no pain. Everything is okay. So I think taking steroids is not helpful anymore, especially that they have many side effects.
Okay, yeah, I understand what you have been through. So do you know is there so you have noticed improvement with the medication, and that's good thing. And you mentioned side effects, so could you please tell me what exactly you started to feel since starting that steroid medication?
Well, I didn't have anything, but I heard that corticosteroids that has many side effects. If you can tell me what are these side effects?
Well, yeah, so to assess this more, can I ask you some questions regarding the early side effects of that medication, if that okay?
Okay.
So do you feel any tummy pain at all?
No.
And have you noticed any recent weight gain?
Yeah, I gained weight. Yes.
All right, how much exactly? Over what period of time?
I didn't weigh myself.
All right, so okay, that's good to hear. So so now, James, I would like to tell you more about the side effects of steroids. So the early side effects of steroid medication taking is weight gain and maybe tummy pain, maybe some symptoms of indigestion, and also there are also some long-term side effects of that medication, like it affects our stomach. It can cause ulcers. Also, it weakens immunity and make the body more susceptible to infections, and also it weakens the bone. Is that clear? Are you able to follow me so far?
Yes, doctor. So there are many complications of this medication. So I think that I should stop corticosteroids, just not to have these side effects.
Yeah, I can understand that you might think about it because of the side effects of that medication. However, I would like to emphasize that it's not recommended to stop taking steroid abruptly or suddenly, as this will lead to severe consequences. Would you like me to discuss this with you in more details?
Hey, what do you mean, doctor? Can you elaborate more, please?
Well, let me explain this to you as we generally not recommend to stop taking steroids suddenly, as if you start taking it regularly, the body will stop by time producing the steroids from itself. And so if you try to stop it suddenly, this will may lead to some complications, as the body will be affected with not having steroids as usual. Is that clear so far?
Right. So can we stop it gradually then, from now?
Yeah, yes. It is highly advisable to gradually stop steroid medication so we can prevent any serious complications or consequences.
Mm-hmm. Okay. All right.
All right, James. So right now I'd like to ask you if you have any other symptoms of increasing pain or anything.
Okay.
All right. Do you have any increasing
Mhm.
pain? Yeah. No.
No.
Okay. So you are feeling completely fine now.
Yes.
All right. And I would like to ask you, apart from that condition, do you have any other medical conditions?
No.
Are
Just
you on any other regular medications?
no. Just steroids.
All right. Are you allergic to anything?
No.
Okay. And do you still work?
Yes, I'm working.
So what do you do for
No,
living?
no, I'm not working. I'm retired.
Oh, all right. And who's else as you? Do you feel that you have enough support around regarding coping with that condition?
Yes. I do have my family around supporting me. Yeah.
Okay, that's great. And regarding lifestyle, do you smoke?
No.
Do you drink alcohol?
No.
All right. Do you exercise regularly or having some activities?
Yes, I walk every day.
Okay, that's good. Now, James,
Doctor,
we
I've heard that it's like the medications that builders take. Are they the like steroids that the bodybuilders take?
well, I understand that you might think that the steroids you have been prescribed is like the steroids that bodybuilders are taking. However, I would like to assure you they are not the same. The
Mhm.
bodybuilders actually take an anabolic steroids, all right, and it is called steroids. However, it's not like that. It's other hormonal treatment,
Okay.
and the one you have been prescribed is not like this.
All right. Okay.
Okay, so now, James, I would like to discuss with you more
Move on
about.
to the next station.
Time's up. All right. Thank you, Dr. Ahmed, right?
No, Mustafa.
Dr. Mustafa, sorry. So how do you feel?
I didn't complete the task as it's mentioned here that we need to add some treatment to that patient.
What happened? Yes.
Yes.
So you are FY2 in the GP surgery. James Smith, aged 80, has come for follow-up. Other information, 3 weeks ago, he presented with shoulder and pain and hip pain. Blood test showed ESR 55, CRP 45. He was diagnosed with polymerase rheumatica and placed on steroid medication. The plan is repeat the bloods in 3 weeks, so you can tell him.
Yes.
In
Yes.
addition,
So I didn't have enough time in the last part of the consultation to talk more about our next plan of management.
yeah.
Yeah.
All right.
The whole time was on dealing with the patient's concerns, actually.
So instead of asking about smoking and alcohol and exercise, you can tell him, okay, we can shortly we can talk about some lifestyle modifications, but I would like to tell you that what is our plan of management. So you can, I mean, instead of asking about them in as a history taking, you can put them in your management plan. Got me? You can put
Yes.
the lifestyle modification. You can put them in your management plan.
Yes,
Right?
yeah, I got your point. And regarding addressing the patient's concern, as he mentioned to me earlier that I want to stop the medication now. So could I address it as I did, or just keep it also to the management part later?
You can keep it to the management part, or you can, it's based on what you prefer. All right?
All right.
As long as the consultation is going logically, all right, in a logic manner, it doesn't matter. All right? If
Yes.
you are a one who is not concerned of addressing the patient's concern on time, it doesn't affect your your confidence, or it doesn't affect your systematic way of thinking, it's okay. But if you are one who is will be affected, you will be hesitant or not confident if you just address the patient's concerns on time, you can just tell him, all right, I can address that shortly if you don't mind. Okay?
All right.
If it is related to a medication, but if the concern is related to psychosocial part or feeling of the patient, it is not appropriate to tell him, well, okay, I'll address that shortly. Got me?
So that applies to this one, or not?
It applies to this one. So he is concerned about medication. He's not concerned about his feeling.
Yes.
All right. He's not concerned about something related to his feelings or a difficulty he's facing in his life. So talking about this in the management, it applies to this condition. Got me?
Yes.
I
So
mean,
yes.
his concern is related to a medication, not related to a difficulty that he faces in his life.
Yes, so what I did is not completely wrong. However, how could I manage to addressing his concerns and then complete my task as the STEM is telling here?
Well, if I were you, what I'm going to do is just telling him, all right, I can see that you are concerned about stopping steroids. And I will answer this question just shortly, all right? I just want to make sure that the steroids are working okay, you don't have any symptoms, you don't have any problem with them, and then we can address that. Okay? Then you
Or
ask him about the symptoms. Do you have any symptoms, any problems with the steroids, any weight gain? You ask about the side effects, any weight gain, any tummy problem, any tummy pain. You also can ask about vision affection. Polymyalgia rheumatica is associated with GCA, all right?
yes,
You
yes,
ask about vision affection, headaches, all right, as a safe doctor, all right?
yes,
Then after that, you ask about psychosocial part. Who do you live with? How have you been affected by this problem? And then after that, you talk about the concerns and management, if I were you. But the
all
way
right.
you dealt with it, it's fine. It's fine. But you didn't manage to complete the task. This is the thing.
Yes, it's a problem, yes.
All right? So your task is telling the patient that you will repeat the blood test in 3 weeks. You will add bisphosphonates and lansoprazole, and you address his concerns. In addition to telling him stopping steroids, it's not advisable. All right, and you are not going to taper the dose now to stop. All right, you are going to taper the dose to continue on the lowest dose of steroids for at least 1 or 2 years. Got me?
Yes, yes, yeah. So you will firstly tell him that it's not recommended to stop the medication suddenly, and you need to continue taking the medication and continue follow-up, so we can see if we can decrease the dose gradually.
You can decrease the dose from now gradually. Okay, tell the least dose, and you are going to continue on the least dose for 1 or 2 years.
Yes, but the blood testing showed that his condition is not improving. The ESR is 55 and CRP is 45. So I believe that he needs to continue with the same
You
dosage.
can continue 1 more week or 2 more weeks and then taper the dose. So the tapering the dose after 4 to 6 weeks of
Yes, all
treatment.
right. Okay.
All right.
Okay.
Okay. So the management should include talking about stopping steroid is not recommended. All right.
Okay.
Steroids should be continuing for at least 1 or 2 years. All right, and should include the test in 3 weeks, and should include bisphosphonates and lansoprazole as an additional treatment. All right.
Okay.
What else? When you talk about the side effects with the patient, don't scare the patient. Steroids has many side effects, all right? But the patient should continue the medication for 1 or 3 years, or 2 years, maybe 3 years, all right? So as part of your communication skills is telling the side effects, but reassure the patient. Don't tell him, all right, it can cause osteoporosis, it can cause ulcers in the stomach, it can cause, you can tell that, but without scaring the patient. Telling him, all right, so there are many side effects of steroids, as any medication in our life. Any medication has its own side effects. Let me explain to you what are the side effects of steroids. It can lead to weight gain, but we can help you in controlling your weight by a dietitian, or controlling, following you up every now and then. It can cause some problem in the bone, weakening of the bone, but we can control that by some medications. It can lead to ulcers in the stomach. That's why we need to add a medication called lansoprazole. All right. So always tell the side effect and reassure the patient. If you tell the patient facts of the side effects, the patient will not take the medication, will not continue on the medication. Got me, Dr. Mustafa?
Yes, I got you. So whenever we say side effects of a medication, we offer solutions for that.
You offer solutions and you reassure the patient. The patient should take the medication for 2 years. Don't scare the patients from the medications. If you just recite facts, this is not a nice communication skills with the patients. That's why counseling is important. It tests your
Okay.
ability of, communicating with the patients, right?
Okay, so we can reassure him by telling him that there is something that we can do for these side effects and then mention it.
Yes.
Yes, okay.
Got me?
Yes, I got you. Thank you.
All right. Thank you, Dr. Mustafa. So we have talked about the task. This case is medication counseling. There is a medication. You counsel the patient about a medication. You check his compliance on the medication. You check the side effects, and you answer his questions and review the medication. All right. His concerns were what?
Yeah, that he want to stop the steroids.
You want to stop, and you address that. And is it anabolic steroids? It's not anabolic steroid. You've answered this question. Okay.
Yes.
All right. Okay. Let's do the last case, doctors. Who is ready? I don't know. We're done with Dr. Ayad, Dr. Ahmed. We're done. Dr. Abir. I think Dr. Abir left us. Dr. Abir, are you with us? Done with Dr. Ala, Dr. Hajar, Dr. Omar. Again, I'm calling your name, Dr. Omar. Dr. Omar. No. Dr. Muhammad. 21st of August. All right. So anyone interested in doing the last case?
Doctor, in 15th of May,
Who is?
Jihad.
Dr. Jihad. All right. Okay. Let's do the case, Dr. Jihad.
Okay, thank you.
Read the question, please.
Begin.
Hello, I'm Dr. Jihad Mutwalli, GMC number A02223926.
Hello?
Hello, I'm Dr. Mutwalli, one of the junior doctor here. I'm speaking to Lauren Black.
Yes, doctor.
Could you confirm your age for me, please?
I'm 35.
How would you like to call you for today?
Call me Laureen. The patient has learning disability. Okay.
Okay. Well, Lauren, how is your admission so far?
My admission is okay, doctor. I'm going home.
Well, and are you happy about going home?
Yes.
Well, Lauren, I'm happy to hear that. Lauren, how is your recovery till now?
How is?
How is your recovery till now?
It's okay, doctor.
Well, Lauren, some people, Lauren, has facing challenging in their life, and I understand from the note that you have some challenging. Could you tell me more about that, Lauren?
Well, what challenges, doctor? I don't have challenges in my life.
Do you have any difficulty in dealing with anything or difficult to understand anything, Lauren?
Oh, yeah. I don't like medical terms. I don't understand any medical term, doctor.
Yeah, okay, well, Lauren, that is fine. I will explain everything to you in a simple way, Lauren. And
Okay.
if you want, and I can draw for you, or writing, if is that okay with you?
Yes, okay, that's okay, doctor.
Well, Lauren, since admission till now, Lauren, is it your symptom improve?
Yes.
Do you have any new symptoms, Lauren?
No, I don't have any symptoms.
Well, Lauren, have anyone explained to you your condition?
No.
Well, Lauren, I explained that to you. Lauren, you have been here because you have leg pain, and when we do some tests, we found that you have block in the vein in your leg. Am I clear so far, Lauren?
Block in the vein. Well,
In the vein is the which carries the blood in your body.
okay.
You have a block inside it. Am I
Yeah.
clear so far? So,
Okay.
Lauren, I want to ask you some questions to know what causes this condition to you. Am I clear?
Okay. All right.
Well, Lauren, do you have any medical condition?
No.
Do you use any tabs or medications?
No.
Well, Lauren, do you have any allergy? Anything cause rash?
No.
Well, Lauren, do you have any family history of heart problem, legs problems, or brain problems, like
No.
stroke?
No.
Well, Lauren, do you smoke, Lauren?
No, I don't smoke.
Do you drink alcohol?
Yes, I can't wait to go home to drink some beer. Yeah.
How much do you drink normally, Lauren?
Not very big. Just twice a week, something like that. Yeah.
Well, Lauren, that is fine. Lauren, did anyone explain the medication you will be discharged on it?
No.
Well, Lauren, let me explain to you. But before that, Lauren, who do you do for living? What do you do for living?
I'm working in a supermarket as a cashier.
Yeah. And who do you live with?
I live alone.
Well, Lauren, any support around you?
No, I can manage.
Well, Lauren, let me explain more for you. Lauren, as I told you, you have a block in some vein, and this block due to your blood. It should be like a water, and your blood convert to be like a gel. That's why this blocking happen.
Okay.
And to control this blood and to keep it like a water, we need to use some medications. Am I clear so far, Lauren?
Yes.
So, Lauren, we want to start you a medication called warfarin. Is that okay with you?
What? Can you say that again, doctor? What?
I will write it for you, Lauren.
Okay.
Yeah, is that can you read it? Warfarin.
Warfarin.
2 minutes
Okay.
remaining.
Okay.
Yeah, but Lauren, this medication, we need to monitor this medication in your body regularly. So in first 2 weeks, Lauren, we need to have you here every morning to monitor, to do test called INR. This test to let us learn, let us know how the medication work and how the level of the medication in your body. Am I clear so far?
Can you repeat that again, doctor, please?
Yeah. We need you to come every morning to do some tests to know how is the dose is suitable for you or not.
Okay.
Yeah, and also, Lauren, there is some things you need to avoid it while using this medication. I will write everything to you, like some choices, like some food. I will write everything to you to read it later on. Am I clear so far, Lauren?
Yes, doctor.
Yeah, well, Rodin, I want to be cautious about some symptoms. If you have any bleeding from any part of body, if you we will experience any head injury, or if you um, have any injury or bleeding from any part of your body, please, Lauren, stop the medication and call the doctor immediately. Is that
Okay.
okay with you, Lauren?
Okay.
Do you have any concern, Lauren?
No, thank you, doctor.
Well, Lauren, do you expect anything from today?
No, doctor. So can I travel, doctor?
Lauren, yes, Lauren, you can travel, but Lauren, it's better
Move on to
to
the next station.
adjust your dose and make sure everything is okay before that.
All right. Okay. Okay.
Okay,
Thank
thank
you.
you.
Thank
Oh,
you. Can you tell me, doctor? Thank you, Dr.
Jihad.
Dr. Jihad, about your comments about your performance.
I don't know, really.
Can you say that
Uh,
again?
I don't know what I think.
All right. Okay. So you did it well, Dr. Jihad. Why
Oh,
do you say I don't know? You did it well. Okay, you were very kind with her. You tried to find out what is her learning disability, what are her learning needs, what does she need exactly. You didn't use any medical jargons. You tried your best to help her in explaining everything, which
I
was
should explore her concern early. Yeah.
her.
I should explore her concern early. Ask about her concern.
No, it's
In,
fine as long as you asked it in any time of the station. It's not a big problem. All
yeah,
right.
okay. Okay. Thank
You missed a few things. One of them is in the history taking. You didn't check one of the contraindications of warfarin.
Begin.
Can you tell me what is this? What is it?
contraindication.
Of warfarin.
I ask about the medication, bleeding,
Pregnancy, maybe.
pregnancy.
Did you ask about bleeding tendency?
No.
You didn't.
Yes.
So it's one of the main contraindications of warfarin.
And here, should I ask about her sexual history and chance of being pregnant or no? Because the age is 35.
Sexual? Why
It's
sexual?
like any chance to be pregnant, or should I advise her about that or no?
Yeah, you can ask about pregnancy, but sexual is not appropriate at all in this case.
Okay.
If you want to ask pregnancy, the patient is pregnant or not, ask the question right away.
I say any chance you may be pregnant.
Any chance you might be pregnant, and that's it.
Okay, that's
Right?
clear.
Yeah.
Mm-hmm.
Okay. Okay. So just give me a second. And I'm coming back. Just give me 1 second.
Okay.
Sorry, doctors. Can you hear me?
Yes, doctor.
All right. So it's important to ask about about the bleeding tendency or taking other blood thinners as a contraindication. In this case, what is the type of this case? Explaining a new medication in a learning disabled patient. So 2 approaches in one case, all right? Explaining a new medication. So you have to explain the medication. And before you explain the medication, one of the most important points is checking the contraindications of giving this medication, all right? What else? So the type and task, body language. I can't comment on your body language, but I can comment on your way of communication and tone of voice. It was good, proper, and appropriate to the situation. Interpersonal skills as well. You tried your best to be simple as you can and friendly as you can. All right? Data gathering, it was organized, relevant, just you missed asking about the bleeding tendency. And also you can ask about what else? Safety at home, maybe because she's going to take, especially in elderly, but the patient is young, to be honest, young age in this case. If the patient is elderly, you have to check safety at home, all right?
Okay.
In management, you should have talked about alcohol.
Yeah, yes.
Yeah, alcohol can affect the effect of warfarin, all right?
Yes, yeah.
It's advisable not to drink alcohol while you're taking warfarin. Management, you should tell me that what is the dose to start with in warfarin and for how long and what else? The INR, checking the INR, and talking about alcohol. These are the points that you have to talk about. And lastly, if she wants to travel, it's better not to travel until maybe around 4 weeks, and then you can talk to the airlines to check, what are the precautions that she should take while she is going to travel. All right?
Yeah. Okay.
Okay. All right.
Okay.
So
Thank you very much.
good, very, very good attempt, Dr. Jihad. Your exam is still in August, but yeah, you did it really well.
May 15th of May.
15th of May.
Yeah.
Oh, who is in August then? Oh, I mixed people up. All right, so good. You did it well. So I'm telling myself she's prepared, mashallah. So yeah. All right, good, Dr. Jihad. Good.
Oh, thank you very
All
much.
right, do your best, darling. Okay. Let me see your questions quickly before I go. The recording, yes, inshallah, on YouTube. I think I answered this question. Do we have to ask ICE? I've answered this question. Dr. Mustafa, would we refer the patient to specialist? I've answered this question as well. Is it going to be recorded? Yes. Your groups, my group links. I didn't see that. Okay, my group links are here. Again, if anyone wants to join. Copy and paste. And here you are. Study partner, Facebook, Telegram, and YouTube. Who else? Dr. Ala. Sorry, doctor, my screen was fine. I could have leave now, but please read my message. Okay, I will read. Where can we find the older mocks? The older mocks are in the YouTube channel. You just click on YouTube channel. I've shared the link. It's on the YouTube channel. You can find many videos, useful videos and useful playlists as well. A playlist for teaching gems, playlist for older mocks, playlist for understanding PLAB 2 and marking criteria, playlist for practical part. All right. So yes. Could you repeat management? Management of what? Dr. AB. Dr. AB. Someone wanted to ask me a question at the beginning, and I told him at the end. Who was that person? Can you please share your question with us, doctor?
Yes, doctor, that's not me, but I have questions as well.
Of course, who is that?
Ala.
Dr. Ala. Okay, yes. And Dr.
Okay.
BC as well, raising her hand or his hand, please do share your concern. Yes, Dr. Ala, you can tell me.
Yes, I have question on the case of the back pain.
Okay.
So how we differentiate the back pain due to meds, that's when we refer for radiology, and the back pain that we offer painkiller, and what is the right painkiller? Is that codeine still patient risk concern of she is taking care of the young people of her child? So how to do that?
All right. Usually, why do you want to differentiate? It doesn't need differentiation. You just can you say the question? Do you want to differentiate
So
between
the
the
patient
pain?
had the back pain, yes, and she asked you like, what do you think?
Again,
The cause of the back pain. She said the back pain, it could be due to the medicine in my bone. So from PLAB 1, we learned that metastatic bone, the treatment is the radiotherapy to the bone.
Well,
So
okay.
here, do we offer codeine in this case particularly?
Okay. So she didn't say it could be. She said they told me it is metastasis from the
From the
breast going to the bone. All right. So
Okay.
it is
Yes.
confirmed. All right.
Yes.
It is confirmed. The pain management of in any pain clinic, you give the painkiller which is matching the severity of the pain. All right. In this case, it's 5. 5 is okay with codeine, non-steroidal, cocodamol. All right. But 7 and above, you can give morphine. All right.
Okay.
It depends on how bad is the pain. You can start the patient on radiotherapy if it doesn't work. All right.
Yeah, I think the palliative will do the.
Yeah, there is steps in the plan. You start by the first step, then the second step, then the third step. All right. Radiotherapy is one of the options.
So we give here the codeine, right?
Yes, you give her codeine, and you can tell her one of the options is radiotherapy. We can try that if it's not working.
So how to address the concern about she's being a childminder?
She's not a childminder. She's looking after
For
her grandchildren.
Yeah.
You can tell her, all right, I do understand that you are caring, you are a caring grandmom, and you are concerned about your grandchildren. As Dr. Nada said, she can take codeine at the bedtime, all right? And if she feels any drowsiness, then she can take our advice, all right? So this is.
So not everyone taking codeine will experience the drowsiness?
No, not everyone. It depends on.
Okay.
Okay. Usually people who are not used to take caffeine and these things, they tend to have drowsiness at first. They might be sleepy,
Mm.
right? More sleepy than usual, but drowsiness, not everyone,
Okay, I got it.
right?
Thank you.
Yeah,
Yes, I have another question
yeah.
about the warfarin. Can you tell us the dose of the warfarin and for how long this patient with a DVT can take it?
5 to 10. You start usually by 5 milligram to be taken one day. All right.
Mhm.
If the patient needs more, they can. All right. They can
Mhm.
add more to be 10, but initially it's 5 milligram. All right.
Okay. Yeah.
Okay. And then after that, you give a maintenance dose. So initially 5 to be taken on one day, subsequent dose dependent on the thrombin time reported as INR. Okay, and then whereas elderly patient to be given a lower indication dose, maintenance 3 to 9 milligram daily to be taken at the same time each day. And usually it is between 3 to 6 months the usual dose, the total dose of warfarin. All right? Okay. It depends
All
on
right, doctor. Thank you very much.
the type of the size of the DVT and the clot as well. And the risk factors, many things. All right, but initially it's 5 milligram. Okay.
Okay. Yeah.
Else has a question?
Yes, doctor, if I can.
Yes, yes.
Yeah, so thank you very much for the informative session. In the epilepsy case, so we did today, so in the reviewing his new attacks of xenofit attacks, can we only ask about does it seems like the previous fits before the diagnosis, or should we specify like how long does it last, and did you bite your tongue to make sure it is the epilepsy one?
Okay, your question is good. And I used to ask this question. I'm usually asking this question. Is it similar to
Yeah, because of the time, it's a counseling session, so
yeah.
yeah.
Doctor could repeat management. I can't remember which management of the case. What shall I tell her about her concerned drowsiness? We've talked about this. And telling her benefits that he is responding. I don't understand, and telling her benefits that he is responding, right? Doctor, if you are with us, please switch your mic on and tell me what is the meaning of your question, if you don't mind. Case of cancer breast could repeat treatment. Dr. AB, it was in steroid case. I didn't understand or didn't get what you mean by your question. I didn't get what you mean by your question. If you can just, if you don't want to switch your mic on, you can just write again if you don't mind. Case of cancer breast could repeat treatment. Yes, treatment of cancer breast pain. The patient present, yes, pain in the back, right? Yeah, painkiller, which is matching the pain severity, right? And physiotherapy. You can start bisphosphonates to the patient. And this is as a medication. You can give her an option of radiotherapy. If you tell her if there is no improvement, we can consider radiotherapy as well. All right. And in terms of the patient, what the patient can do for herself, you tell her about hood packs on the back, and yoga and massage will help in her condition. All right. What I understand from your question, doctor, is that do we need to give the side effects to the patient and then reassure the patient? Is this your concern? I am not sure what's your question exactly, but If my understanding is right, yes, once the patient is taking a medication for a long time, and this medication has many side effects, do not scare the patient from the side effects, especially if the medication is crucial in the treatment. You are not going to lie on the patient. You tell him or her the side effects, but with, with reassurance, with some reassurance. That's why counseling is important. It's about, communication skills. Yeah. All right. So I think we have finished all of the cases, your questions as well. I've answered all of your questions. Inshallah, I will see you in the next week. 11 a.m. inshallah as well. If there is any change in the time, I will announce on the groups. I hope it was helpful and it was useful. Thank you for attending. Thank you for listening. Yes, thank you so much. Thank you, Dr. Aya. Thank you, Dr. Jihad, Dr. iPhone. Thank you. Thank you. Thank you. I'm not sure, Dr. Bessie, you've raised your hand and you didn't ask. Do you still have any question? Thank you, doctors. Thank you so much. Thank you. I asked, yes. Oh, you asked. All right. Okay. Thank you so much, and see you in the next week with another helpful session, inshallah. All right. Yeah.